I'm Joanna Doven. This is On Crisis, bringing together PR experts, thought leaders, creatives, and CEOs here to start conversations and connect people with real-life stories in crisis communications. The COVID-19 pandemic really shone a light on senior care facilities and nursing homes. What the heck is happening inside of them? These facilities are rarely in the media spotlight, but now they're facing a crisis communication storm. We talk with award-winning reporter Sean Hamill, who has reported for the New York Times, Chicago Tribune, and is currently the lead health reporter at his hometown city's paper, the Pittsburgh Post-Gazette. His recent series into one of the largest COVID-19 outbreaks of any nursing home in America has led to data reporting measures, an AG internal investigation. Basically, all of the nursing homes, at least in Pennsylvania, are being looked at now. It's amazing how good local investigative journalism can impact and change lives. And without it, oftentimes bureaucracies in government is just too busy or really too stuck in the mundane to pay much attention. Sean's a big news veteran. He's been in the business since he was a teen. So we discussed the future of local newspapers and how they can be saved, something that I care deeply about. His insights into why he thinks Google and Facebook should play a key role in local newspapers and local journalism's comeback is very interesting. And of course, we dive into really what's happening inside of these facilities. How do they make money? And if we can follow how they make money, we can start to unearth some of the root causes of the problems that lead to lack of care, lack of infection control, and ultimately how some of these facilities literally became COVID-19 death camps. When I think of the real results of Sean's reporting, and there's many other series he's done in the past that have led to changes, I think about this quote he gave in the podcast that was attributed to one of his professors in school. And it said, the quote was, "Local news is at the heart of what makes America work. You have to have eyes on the mundane. You have to have eyes on the mundane." I look forward to you all liking and sharing this episode, especially if you care about the most vulnerable population, which is, our youths, our children, our seniors. I think about my own family, my mom, who at some point in her life is going to need extra care. And wow, I'm afraid if I can't take care of her, I'm afraid of how our system right now is monitoring these end-of-life facilities. Listen in. So excited to have Sean Hamill, an investigative reporter with the Pittsburgh Post-Gazette, here with us today. He is one of the most thorough, articulate reporters that I know of, and I've been in the business for a long time. Sean, we're going to talk a lot about what's happening in America's nursing homes based on your reporting here in Pennsylvania. The pandemic has shown a really bright light on nursing facilities and senior facilities when it comes to what the heck they're doing, how they're reporting, how they're communicating with families of patients, and really with governments. Before we get there, let's talk a little bit about you. Tell me, how did you get into reporting? What was the bug always there? Take us back.
I didn't know that the bug was always there. I always liked writing. For whatever reason, I loved comics as a kid, and that was about the only thing I wanted to read. But when I was 10, I needed to get a job. My dad lost his job here in 1976, like so many other people in Pittsburgh during the recession of that year. And we didn't have as much money, so I went and got a job delivering the Post-Gazette. And I didn't notice it right off the bat, but I slowly started to become more and more interested in reading the paper I was carrying around. I would, when I would walk the route, initially, I would just read the sports section when I was 10, 11, 12, 13. The last 2 years, 14, 15, going into ninth grade, I found myself wandering over to Phil Music's column. He was a great columnist for the Post-Gazette, and then wandering to the local section when there was a mention of my hometown, Sewickley, or something on the front page that caught my eye. And it just sort of creeps up on you, and all of a sudden you start reading about everything. And I still didn't think I was a writer until I was in college and thought I was going to be a business major, and really I really didn't like that. I didn't like the courses I was taking. It all felt like Greek to me. And I had teachers in high school tell me, you should be a writer. And that just didn't make any sense to me, because I didn't know anybody who was. I didn't know what that meant. Like in my mind, writers were these amazing creatures that sort of were like born writing, and I didn't feel like I was that. And then when I was a sophomore in college, my next door neighbors moved in. They were both photographers at the Pittsburgh Press, and they had just come from the University of Missouri. And they noticed that I was freelance writing in the sports section of the Sewickley Herald just for fun. And they said, "Why don't you do this?" And I was like, I don't know. I don't know if this is what I want to do. And eventually I decided it was what I wanted to do. And they said, "You should go to the University of Missouri." And I applied, and for some reason they let me in. And I loved my time there, and I learned how to write and edit and do a decent job of taking photographs, and started working in newspapers, first in Missouri for 3 years, and then 12 years in Chicago. And then when my first son was born, we moved back to Pittsburgh, and I freelanced for a while, mostly for the New York Times. And then 10 years ago, next month, 10 years ago next month, I got hired at the Post-Gazette, and I've been here ever since.
Wow. So it's an incredible story, because at 10 were involved with newspapers, and, found I guess your passion. Not everybody gets to experience having their passion be their career. But what kind of journalism has excited you the most? I mean, I know you've had a lot of awards for your journalism, but I see you as a top-notch investigative journalist. Talk to us about your top three, stories that you felt really made a difference, or, excited you.
Well, for the last 10 years, most of those stories have been health related. I was originally hired as a health reporter, and over time, they let me do longer and longer stories, first under David Shrimman, now under Stan. And one of the earliest stories that we did was myself and another reporter at the paper, John Silver, that came out of really the kind of anecdotal looking around that you do when you're a reporter, when you're covering a beat. I had noticed that UPMC, like everybody did by 2010, 2011, had gotten really, really big around here, right? They had bought up a lot of hospitals. And I became curious about why they were buying them, what they were paying for them, where they bought land. And so I started to try to make a list of all the properties that they owned. And that proved much more difficult than I ever would have thought. I thought I could go into the county computer and put in UPMC or University of Pittsburgh Medical Center, and everything would come up. But I noticed really quickly that that wasn't the case. A lot of the properties they owned weren't under their name, because they bought the business, if you will, like Mercy Hospital, but they never changed the title, because you're not required to when you buy the business of the property. So I had to go piece by piece, every place that I could find an address for them, and then look on a map and look at all the parcels around them to see what they really own. And what we came up with was just a staggering amount. And it's so much larger now. I mean, it's probably time to do a revisit to that 10 years later, because they've only gotten that much bigger, and not just here in Pittsburgh. We focused primarily on Allegheny County, but as you and everybody else knows, they now own hospitals into central Pennsylvania, into New York, and they're looking further afield than that. That story had a lot of impact because one of the central tenets of what we found was that they had become so um, powerful and wealthy as a corporation that when they decided to move into a neighborhood or they wanted a corner or a section of land next to an existing hospital, they could literally pay whatever they wanted to ensure that they got that parcel. So what we found generally was that they paid way, way, way more than market rate for properties, so much more that they were like upsetting the property values beyond that, the parcels they wanted into neighborhoods. And then if things didn't work out and they decided they didn't want those parcels, they sold them at a huge loss. And it was that story that in part led Luke Ravenstahl, the former mayor, to file a lawsuit challenging UPMC's nonprofit status.
Which was quite, I was the press secretary at the time.
Right,
That was
right.
quite,
Yeah, that was pretty.
I remember that story. And I
It
remember
was a shocking move. And then Mayor Ravenstahl told us that our stories were one of the reasons why he decided to file it, because it was so stunning to him that a nonprofit hospital that's supposed to provide healthcare was spending so much on land, literally at will, wherever they wanted to.
Well, the problem is, the city is small, 45 square miles.
Right.
If I recall, and about half of our taxable land is not taxable because of UPMC,
right.
And then you take into consideration educational institutions.
Right.
And I remember the mayor and his team trying to increase the pilot payment in lieu of taxes, right?
Right.
And there just being absolutely no appetite for that. And then your stories, it was around the time your stories were hitting, and it gave backbone and credibility to the whole argument.
Right. And that was going on in the courts. And then when he left office, Mayor Peduto, one of the first things he did that first year was, as he said, strike a deal with UPMC that they were going to work on some payment system to the city. And he dropped the lawsuit. We still haven't seen the results of that deal. We're still waiting. That was, I want to say, 5 years ago now.
That's due for a follow-up too. You're going to be busy after
it
this.
Is. Well, we check in from time to time. I know our City Hall reporter, Ashley Murray, has checked in on that. That still, and that UPMC wasn't the only one. There were other institutions that were supposed to pay into this community fund that Mayor Peduto wanted to create. I know there are a lot of people in the city anxious to see that created. I know the pandemic has probably upset that for a lot of reasons this year. But
I don't know if you realize this, but so you're reporting, and which sort of the domino effect of your reporting. So that led to everyone's eyes being wide open with regard to the amount, like the economic impact that nonprofit land that's not taxable has on communities. And there was a lot of pressure on UPMC. And then in 2008, right around the same time, what did they do? They announced the Pittsburgh Promise.
Right.
$100 million as a way to say, look, it was a brilliant PR move. So,
yeah. Well, the one of the other upsides or results of that was one of the things John and I stumbled upon. We went trudging through literally a dusty, dingy basement that the county kept its nonprofit application records in. They just kind of pointed us to this room in this place over on the east side of town and said, they're in here somewhere. And they let us just troll through these boxes with like rubber bands that would snap apart into pieces the second you touch them. And we went looking for UPMCs, and we could have done it for any nonprofit, but we went looking for their applications for every parcel that they owned. And if memory serves correct, I don't believe we found any more than 50% of the applications. This, in essence, the county could not validate that any of those parcels that we didn't have applications for deserve their nonprofit status. And the result of that finding was that the county ordered, for the first time, a county-wide nonprofit reapplication process where they asked every nonprofit to reapply and justify their nonprofit status on land. That had been put into the county regs, I want to say close to a decade prior to that. They just had never enforced it. It was supposed to be done, I believe, every 3 years, kind of like a triennial reassessment that some counties do. And they went through it, and there were quite a few parcels, many more beyond UPMC. I think UPMC may have overturned the nonprofit status on one parcel, but there were many parcels that had to lose their nonprofit status, typically because the use of that property had changed over time, even if the owner hadn't. But that was a huge undertaking. The county dove into it. I believe that they finally finished that after about 3 or 4 years, because they ordered a year after our series ran, and it took them years and years to get it done, because there are tens of thousands of parcels in the county, and as you said, a huge percentage of them are owned by nonprofit partners, and not just hospitals and education institutions, but that include religious exemptions, the churches all over the region, synagogues, mosques, Boys and Girls Club owned property, things like that. And they reviewed every one of them. And that's probably a good thing to do, especially when, you are not just in the city, but in the county. You're looking for tax dollars that you deserve rightly. And you want to make sure that those properties are on the tax rolls if they deserve to be.
Absolutely. Then we can't invest in things like infrastructure.
Yeah.
So give me one more story before we dive into the nursing home
Sure.
conundrum that you'd like to tell our audience. I mean, it's interesting to think back on the impact you've had in the region through your reporting at the Post-Gazette, especially in light of how newspapers are struggling, and how media has changed over the past 10 years. Let me ask you a quick question about that. How do you feel about the present and future of, independent newspapers like the Post-Gazette?
I unfortunately have to say, I think it's in doubt. I mean, there's just too much evidence across the country. I mean, there are cities, and we're close to being one of them, that don't have a paper, have gone all online. Now, in theory, going online will help us. We will lose the costs associated with producing a paper. But as many cities have found, and some institutions have found, losing the print paper has a downside too. You don't have that physical presence on the doctor's table when patients come in to see the dentist or the doctor. It's not left in a seat on the bus. And online we struggle to, just like every paper does, to not only get our message out, but to get our message out and make it worthwhile to us. There's a lawsuit out there right now. It's the first of what may be many. A lot of our content, because we are the largest still, despite the cuts over the years, including the decade that I've been there, we are still the largest news source in town. We have more reporters than any other news source in town, any TV station or radio station or other paper. And as a result, we break more stories than anybody else. And unfortunately, what you find online, and this is a huge issue, really, as evidenced by what happened in Australia. Australia tried to get Facebook and Google to agree to pay news organizations for content. One of the reasons they did that was our stories end up on Facebook or get searched on Google. That draws people to Facebook and Google. They get more users, right, who want to go there, in part because of all the news they can access there. But the clicks that go to Google and Facebook that they may open our story, that doesn't result in money from Facebook or Google to us. Now, if we were Beyonce, right, and we were making a video of our new song that we wrote or that we had ownership of, and Facebook puts it up on their site and Google puts it up on their site as a result of a click, and then it's opened up and played, they have to pay for that copyright song a fraction of a penny every time it's played. So when you have 1 billion clicks on YouTube on a song, Beyonce is getting paid. Because if my article gets read 1 million times on Google or Facebook, we don't get any money from them.
Yeah, because there is a paywall with the Post-Gazette, but what
There
you're
is.
saying is
Right.
it's only a certain amount of articles. So
Right.
you could still have a million articles of people who have done less than 7 articles a month, and they're still getting that content for free. And
Right.
Facebook is getting the eyes credit, so to speak.
Well, beyond the fact that another issue is that often you will see our breaking stories, especially in sports, but also in news, because we break so many sports stories as well. Our great sports staff, our stories will get rewritten by any number, dozens, if not hundreds of websites. I've seen my stories rewritten, hundreds of times on one individual story. If it was a big breaking national story that had legs like that, it'd get rewritten, sometimes almost verbatim, with not even a link back to our story. So they just use the content. Now, almost everybody does this. There are some papers that have, I don't even know what the term is, but I'd call them like rewrite folks, or amalgamators, where they go and they read stories. And the way they try to get around saying we stole it from the Post-Gazette or whomever is they'll read 4 different versions of the story. And they'll say, in the first 2 graphs, they'll say NBC News said, then they'll say the Post-Gazette said, then it'll said on Yahoo it said, and they'll say this is our original content. Well, they never interviewed anybody. And so, I think it's obvious that the work that we do is incredibly valuable to the public, because 95% of what we do is interviewing people, doing our own reporting and research. We don't have full-time staffers who are doing that, amalgamating, reading news sources, pulling down things like that. We have to go out into the community and call people and visit with people to do stories. That is incredibly hard and expensive work. In the current formula, we don't really make all the money that work generates because of the way that it's used by other content providers, Facebook, Google, and then the hundreds and thousands of other news sites that'll take our work and rejigger it so that it looks like it's a news story. And that happens every day. It's happening right now, I promise you. Coming out of morning news meetings, there's somebody saying, hey, there was a story in the Post-Gazette, hey, let's do our own version of it. If they can't get an easy one-person interview, they just rewrite it. And they might even put a link to the Post-Gazette, and we might get a few clicks. But that institution is going to get oftentimes even more clicks, especially if they're bigger. I mean, the Washington Post does this to us from time to time. They'll get, hundreds of thousands of clicks on a story, and we might even pick up 100,000 more clicks from their rewriting of our story. But I've seen that happen with my own stories on the Post, and some other institutions. It is a scourge. We're all trying to sort through. Believe it or not, we're still really early. I mean, we're not at the Gutenberg press stage of the internet. I mean, we're more in the 3rd inning than the 1st, but we are still trying to figure this out. I don't know what the perfect solution is to making money on this, and I don't think anybody really does. The national papers have a better feel for it, I think, because size really helps in the current internet environment. Being the New York Times and the Washington Post, in terms of making money, is easier because the entire country is your oyster. What we do well is right. What we do great, what we are known for, and rightly so, is Pittsburgh and southwestern PA. Like this is our backyard, and we should do it well. There are some local papers that have tried to use some of that national model. Let's do stories anywhere. They don't seem to result in the same kind of boom that it does for New York Times, the Washington Post, or the LA Times.
Right.
So I'm worried. Just not just personally for my job, but the reason I do my job is because I believe deeply and abidingly in the power of journalism to make the world a better place. And we've all seen what can happen when the news source that people go to is not real journalism, where people are contemplating and wondering about literally every word in a story. We're not just spewing somebody's friend's Facebook meme into a story. We are trying to convey the truth, or near as close as we can get to the truth. That's hard, especially during this pandemic. But we are doing that every day from a variety of different sources, and we can talk about nursing homes and how difficult that's been, especially when you can't physically be in them, that
Yeah.
a lot of people don't feel safe doing in-person interviews. But that, what we do, and I think what real journalists all over the world are doing, is that much more valuable, at the same time that many of us are finding it harder to find real value in terms of monetary, which unfortunately is the current model. We got to find a way to get people to click on our stories, buy our online subscription. It's tough. It's tough. They're much, much smarter people than me at our paper and all over the country trying to figure this out. And
Well, I think
if
a lot of
anybody
it
had the
is,
real solution, I'd love to hear it.
I mean, really, so I have a solution for you. No, I don't. I have a couple of ideas that I've communicated before. And one is that, you know, you all have such expertise in reporting. And let's say you have, for lack of numbers, let's 20 reporters that are just really putting out great content, right? And then you have just one person on digital. That's it. Or maybe half person. And right now, your success is basically what's your digital strategy? That's where it's going. And what I find is many of the local newspapers don't have a real digital strategy. I remember talking with one of your former colleagues about I placed a story for a client and I couldn't get it on Google. I was like just Googling the title of the story, the name. I'm like, why can't I get this? Because what I always have my clients do is when we get a news story, and if they have their own media, so they have social media, they have a website, I'm like, look, you paid me to help you with PR, and then you're just going to let this story just be there in the Google sphere, promote it on your owned media. Let's run an ad on Facebook. And guess what? That benefits the Post-Gazette too, because that's the story everyone's clicking on. Let's do that.
Right.
And I remember one time I couldn't find the story, and it was because the reporter was required to enter it into the content management system with the masthead and didn't know how to do it. Right. So in other words, the lack of digital infrastructure, now this was a couple of years ago, maybe it's changed, prevented the ability to get that story out there digitally. But hey, I wish you guys lots of luck. And the other thing is how can, local newspapers, work together on some kind of lobbying effort, right? Once you figure out what needs to be changed, how is there any kind of organizational structure that exists, do you think?
Well, historically, there has been for a century. I learned this when I worked at the Associated Press. The Associated Press was originally formed to fight back against first radio, which was stealing newspapers' content, and then TV, which was stealing newspapers' content. And at a time, I was told when I started working there, the AP was looking into doing that too. I don't know that they ever did follow through on that. But it would seem that all newspapers, even those that are doing really well right now, like the New York Times, Washington Post, have an interest in that and not having their content stolen, not having social media platforms benefit without providing a benefit to the newspapers. And I am using the word newspapers, right? And which by itself is already almost an archaic term. I wish it wasn't. I miss my morning routine. We're down to 2 days a week here. I miss my morning paper routine, and I still love paper. That's never going to change. But I read probably 75% of the content I read in a given day online. And that's only on the days where there is a paper, because I get the Post-Gazette in the morning on now Thursdays and Sundays. The rest of the time I'm online 100%, just like everybody else. If you want to read Post-Gazette, although I read the PG Reader version a lot, which looks like the paper.
Yeah, I do too.
And then you can kind of flip and still see the same. Your eye can follow the content.
Right. And it's kind of like knowing where a story is placed is
right.
For me, it helps me to frame what I should read in a given amount of time I have. And
right. Yeah. And that's the idea of using the PG Reader. Although, people can also tell the way that we have our website set up, just like most newspapers do online. We try to put the most important stories, or those that we believe have the biggest oomph, front and center with a photo. It's the first, if you're on the tablet like I am right now, it's the first box of 3 or 4 stories that we have that'll have a photo, and then down below photos to draw your eye. So there is still some of that, but is it as easy as opening a paper, pulling up the front page, reading the first 3 graphs on the front page, and then wandering through the rest of it? I don't know. Maybe for some people who don't know different, I still love the format.
So,
That I grew up
so
with.
I have one more broad news question that I'd love to ask guests. Especially guests that are, renowned journalists. What's your news routine in the morning? How do you stay balanced when you're consuming news these days?
It's hard. It's hard. There's so much content to go to. But I read through, scroll through the front pages, if you will, online of 5 papers every day. I start with the Post-Gazette. I go down through the whole front page online on those days when it's online. I work my way through New York Times, the Washington Post, the Chicago Tribune, and the Beaver County Times. The second biggest, I believe, around here, next to the Trib Review. And I read through the Trib Review too. And I have subscriptions to all of those, with the exception of the Trib. I had a subscription to the Trib. It was just, it lapsed. And then I started getting like weird letters from them saying that I owed them $75 and I hadn't signed up for it. So I've never gone back. But, we need, and I shouldn't make light of that, we need more competition. I love having competition.
Yeah.
Every reporter
Totally.
in this town and every other town. I want the Tribune Review to thrive. I want the Beaver County Times to thrive. The Washington paper. The more competition there is in news, the better it is. For everybody. For us, it gets us up earlier, makes us work harder. For the reader, you have multiple sources to go to, different reporters, maybe slightly different takes, but hopefully on the important points, agreement on what the basic facts of a story on. We might have interviewed different people, but you can go to different stories. So like on nursing homes, the one big story I did recently with Brighton, rehabilitation, you can find similar stories in the Beaver County Times, the Beaver Countian, an online newspaper, the Tribune Review. We've all done our hard take, long, big, long story project on Brighton Rehabilitation Wellness Center. I think you will find really good content on all of those sites about Brighton Rehabilitation Wellness Center. You'll find, I think, different points made about what led to the problems there, but I think you'll find agreement that there were problems there, right? That it wasn't an illusion. It wasn't just something that stemmed from the government's problems, though that certainly may have contributed to it. But I think that's what's really great, at least for now. All those institutions still exist. The Trib, us, Beaver County Times, Beaver County, and all 4 have done work on that. I hope we can all thrive in this environment, like it was. I mean, we have to go back a ways to find when everybody was thriving in paper, probably 20 years now. But I think that really helped. I think that really helped the policymakers get interested in this, because not just because Sean Hamill at the Post-Gazette was writing about it, but others at the Trib Review and the Beaver County Times. That's really where a lot of that sort of momentum around nursing home regulations, around problems at Brighton that illuminated larger issues, came from, because I think people who needed to understand that issue got to see many points of view from all the reporting done on it.
Well, and I would go to say, in my experience as press secretary dealing with the media for 7-8 years, I remember when there was a lot of competition, when I got a call from 11 reporters every day. Imagine that, 11, because TV had a beat reporter for City Hall still, talking 2008, 9. And the competition among, Rich Sword and Jeremy Boren, Tribune Review, Post-Gazette, and Andy Gassmeyer and John Dell, like all that competition led to competition within policymakers and elected officials to enact better policies, to respond and be proactive with regard to investigative stories on building inspection or plowing streets. What I see now, because I'm still tied in a bit with the city, I still have a few clients that maybe are developers. What I see now is because there's not much competition, there's less reporting on what's happening in City Hall. And then there's less accountability. And then there's less elected official competition. Then there's less policy making. You can sort of see it happen. Some would say that's good, let the mayor be mayor and have less accountability. But I, for one, don't think it's fair. I tell Tim McNulty, I'm like, you have it so much easier than I have it. And we laugh, but.
No, I think your point's well taken. You can just see it in any daily press conference there. There are fewer people there on a daily basis. And that is really at the heart of the struggle for any media institution right now. Like, because the meat and potatoes of newspaper reporting, really, and really the start of probably all of the best investigative reports, is daily reporting. And
yes.
Unfortunately, daily reporting can be often mundane, seemingly. It's not mundane if the topic that the beat reporter is writing about affects you directly, but in terms of a daily story coming out of City Hall about something where everybody is engaged on, like, oh, we're going to build a new stadium, something where everybody gets excited. That doesn't happen every day. In fact, most days that's probably not the story, that broader big picture issue. But I'm here to tell you, as a beat reporter, long time beat reporter, covering like local city government, schools, zoning board meetings that I've sat in on for hours and hours on end. That is the heart of, as one of my great journalism professors said, what makes America great and what makes America work. You have to have eyes on the mundane, the daily occurrence of government. And from that, all good things are created. Many stories, every investigative story that I've done at the Post-Gazette and everyone prior to that started out of or grew out of daily beat reporting in one way or the other. You often stumble across it just in trying to figure out one fact in one story that has nothing to do necessarily with some bigger, larger story that you might spend months on. I spent 3 months on Brighton, the investigative story we did, in an 8-chapter story that came out in November at the end. But that began as really just kind of beat reporting, really, right? They have an outbreak there. And across time, I did stories about other nursing homes that had outbreaks and other issues related to that, related to what the Department of Health was doing for the state, what Allegheny Department of Health was doing locally. And then you track it over time. And over time, you realize, oh, there is something bigger going on here that is worth illuminating. And that, that just doesn't happen in a smaller newsroom necessarily, or it's an even bigger struggle than it was at the Post-Gazette. For them to give me, from August till November to work on that story and not write, I think I wrote maybe 2 other stories in that time. I mean, that's almost unheard of right now for most reporters. It's just, and we are blessed to be able to do that right now.
Hats off to Stan, right? I mean, that's Stan's leadership too, right?
Yeah. I mean, it's just hard. I mean, it's always hard, really, when you have a beat reporter and you want to take them off the beat and dedicate them to something. And the Post-Gazette has been doing that forever. David Shribman made that a point. If somebody found a story that was worth digging into, he would send them running towards that and give them time to do it. But every newspaper right now, every media source right now, on the TV stations, I mean, TV over the years has done great investigative work, but I can't imagine how much harder it would be for them to say, okay, let's have this news crew, which is usually 3 people, right? A producer, a cameraman, and a reporter, to spend 3 months on a story.
Let me tell you, it doesn't happen in local TV anymore. I'm still
it's got to, and there is some of that. I think Andy Sheehan's done some great work over the years that I don't know how he does it. He scrambles so well, and he's got a newspaper background too. So,
but see, okay, let me tell you, because I've been involved in some of these stories.
Yeah,
he does but he doesn't have the time to really get the full story in these.
Oh no,
I
well,
find them to be very one-sided.
right. And
Important information, but because of that, 1.5 minute segment now versus
right,
3.5 minutes, now we're going to find what's most salacious and what's going to get us ratings.
right. And they have the added constraint of having to always have, or nearly always have, somebody on camera, right? I mean, so TV news reporter's job is that much harder than mine. Like,
Thank
I
you.
can interview 100 people and maybe only have pictures or in the paper for 3 of them, necessarily, where they're willing to be portrayed, let alone be interviewed on camera.
Right.
I mean, that makes it that much harder.
And that's the TV. That's the TV animal.
It is.
I can't get through to some clients about they wonder why this story happened. It's so unfair. And I said, well, you wouldn't go on camera. You wouldn't get anybody on camera. They had to feel that they needed somebody on camera. You wouldn't do it.
Yeah.
You wouldn't allow anyone to do it. What do you think is going to happen? Right.
Right.
But anyways, so Brighton, I want to dive into this because what a remarkable series you did on Brighton, which has led to change already statewide. For our audience, okay. So Brighton is a nursing facility in Western PA, and it's one of the largest, right? How many beds?
It is the 3rd largest in the state. It has, what is the latest count? More than 500 beds. Am I remembering that? 495 beds.
Yeah.
But it's the 3rd largest in the state. It was formerly county run and county owned until just now, going on 7 years ago, and which made it very typical of formerly government run nursing homes. They were these very big institutions who, just like Brighton, grew over time as the need and the customers warranted. And then, unlike Allegheny County and a few others, Beaver County ran the same problem that so many other county governments did. They were just costing way too much. They could not make them break even, and it was costing them a couple $1 million a year to keep that place open.
So the first problem here is is it the federal formula for reimbursement? Like when you really peel back these layers.
Yeah, no, that is the meat and potatoes for nursing homes, is federal reimbursement. 70%, just heard that figure again yesterday, 70% of nursing home revenue comes from Medicare and Medicaid, primarily Medicaid. Brighton has an even higher percentage, north of 80%, although they had driven it down. It was even higher than 90% when the county owned it. And for I'm sure most of your viewers realize what Medicaid means when it comes to a nursing home. Medicaid, when you're having your stay there paid for by Medicaid, that means you don't have any money. You don't have any assets. Your home is gone. Your bank account's been emptied. You might have Social Security, and even then,
you need aid.
The nursing home takes 90% of that every month, on top of Medicaid reimbursing the nursing home for additional care based on how sick you are, what your quote unquote acuity is. They have a rating that determines nursing homes reimbursement based on how sick the people who live there are and how much care they have to be provided. So yes, nursing homes are, with rare exception and very rare exception, are very, very focused on federal reimbursement. And that by itself perhaps has caused many of the problems that have been illuminated, not only through our series, but through a lawsuit that was filed against Brighton, and in other lawsuits in years past that were filed by the state attorney general against other nursing home operators who pointed out many of the flaws in the system, many of which still exist. Is the pandemic going to fix these things so that we don't have those flaws? I don't know. A lot of people seem to think that this is really illuminated things that people knew for a long time.
This is what people need to open their eyes up to. And it just, this is an emotional issue because literally we're all going to die one day. Most of us hopefully are going to die old. We're going to grow old. And let's face it, the way most Americans take care of themselves, you're not going to die fast, right? You're going to be in a nursing facility. You're literally going there in many cases to end your life. And wow, I mean, the vulnerability these residents have, and to not have accountability as to what is going on inside these nursing homes, that's just an huge human injustice. And COVID, the light's been shown, so to speak. So is it the case that because of the federal reimbursement structure, that the sicker these residents or patients are, the more money the nursing home gets? I mean, is that
Yes. Yes.
so? The incentive is stay sick.
Well, it's not that, but what especially the lawsuit that was filed against Brighton showed is that Brighton, over time, under the private owners, has decided intentionally to take sicker and sicker residents. Under the county seemed to take basically anybody who couldn't find anywhere else to go. It was under the county's ownership known as the home of last resort. You might want to go to a swankier nursing home like run by Concordia or St. Barnabas, two other big nonprofits around here. But maybe they didn't have any beds available for you, because many of these facilities, nonprofits and for-profits alike, have a cap. Like, they won't tell you what it is, but a set cap. Most of the ones that make money I apologize for that, seem to have about a 70% cap on the percentage of people around there who can be on Medicaid. And that's because Medicaid only pays X, but the
Private
companies
payers
want to make Y.
So they want private payers.
Right. Sorry about that.
It's okay. So, I mean, don't worry. People are used to this. So again, social injustice, right?
Yeah.
If the more poor you are, your end of life, you're going to most likely receive lesser care. And if your model is like Concordia or St. Barnabas to attract, private payers, then, it leaves those who are less sick. I don't know what I'm trying to say, but so are there two models basically? Either I'm a St. Barnabas and I want the private payers, or I'm a comprehensive care type facility and I want the sickest. Are there two different models here basically you've seen?
Well, yeah, I think it's even more stark than that. I mean, it really is the places like the few county run homes, like Allegheny County has 3 nursing homes, and maybe a few nonprofits that are somehow maybe able to make it work where they do try to take more and more poor patients. And then there's the for-profits, which are driving it in a complete another direction, because Medicaid pays so little. And even then with Medicaid, like, so again, comprehensive, they turn that facility around into a moneymaker in just 1 year after they bought it from the county. One, they drove down the percentage of Medicaid residents. And then 2, they started gaining reimbursement from other Medicare avenues that they hadn't before. They created a rehab unit. It's called the Grove. It's the part of the building that's at the back of the building. And rehab, and this is something that's become very, very common, not only in for-profits, but in increasingly nonprofit homes. They put a rehab unit in there specifically to drive revenue. And you can see it really, really starkly in the numbers for Brighton. Very, very quickly, Medicaid numbers come down, and very, very quickly, Medicare and Medicaid rehab reimbursement goes up. And that by itself really quickly changed the revenue formula. Then on the expense side, they very intentionally and rapidly changed the amount of money that they were spending on nursing staff, nurses' aides, registered nurses, licensed practical nurses. And what they did, because they have a union contract and they couldn't pay less to those full-time union workers, they got rid of many of those, or let many of those go who were retiring and never filled it. And they replaced it with what they call agency employees. These are part-time, typically part-time. They may even work full-time hours, but they work for a quote unquote agency that the company hires to provide people to come and work there. primarily among the nurses' aide staff.
Mhm.
And I looked at the largest nursing homes across the state, and there were only two others that had anything approaching what Brighton has in terms of percentage. Brighton went from having almost no agency staff when the county ran it to having 20% in it almost any given year since they bought it. And that is an incredible turnaround. And you can see the amount of money they spent on the nursing staff drop precipitously after they bought it.
So agency
So
staff, we're talking people that aren't as credentialed.
no, not necessarily.
And
I mean, when it
what's
comes,
the difference?
nurses' aides themselves have to have, right, you have to be a nurse's aide. You have to have had some training just to be called that. But the difference is, one, they're not union, so they don't have all the other benefits that come with it. They don't have a set salary. So when they're hiring these temporary workers through agency, it's incumbent upon the agency to determine how much they're paying them. It's not up to Brighton. So Brighton might go around to all the various agencies and say, hey, we need 20 nurses aides and we're
Yeah.
willing to pay
You should do a
up to
story into these
$15 an hour.
agencies. You should do a story into these agencies, because I was talking with the client about these agencies in regard to, I was asking a question like, where do you guys get your referrals? Like, how do people find you?
Mm.
And in agencies are doing referrals and they're staffing. It seems like they have a lot of control. And who's running these agencies?
Yeah, they're private companies by themselves. And they are fascinating, how they work and where they're finding people. And
We have 3 stories for you at the end of this.
yeah, there you go. Well, and so the question during the pandemic is, well, why does that matter? Right. And what role possibly could they have played in creating the problems that occurred at Brighton in one of the, the worst and deadliest nursing home outbreaks in the country during the pandemic? And what people who worked inside, both full-timers and part-timers, told me was, over time, especially in the early stage of the pandemic, because so many staffers either outright quit or temporary staffers refuse to work there, which is their right. When you work for most agencies, you have a right to say, I don't want to work there. Because of the outbreak, the agencies that Brighton was hiring had to go further and further afield and get new people who had never worked there. And they were coming up in droves. So many of the residents told me, and their families, that while early on you might have seen more local agency staff, people from Pennsylvania, even into Ohio, West Virginia, as they got into April and May, as the pandemic was raging in Brighton, they started seeing on the cell phone calls that many of the nurses' aides would do FaceTime calls with the residents because they couldn't get in the building to see family. And they started to see area codes from like Louisiana, Texas, down south, further and further away. And the way that manifested itself was they had new people in there almost every week when this was raging. And at the same time that things were going badly in terms of the infections and cases and deaths, CDC was changing protocols or increasing protocols, in some cases day by day and week by week. So trying to educate that entire staff, including, I don't know what the number is. I mean, some people told me half the staff at one point was agency. I don't know if that's true. But it was certainly north of 20%, which is what it had been in years prior. So to try to get all those people re-educated every week seems to have proved to have been daunting, if not impossible, because they were knocked during state inspections 3 times for problems with infection prevention protocols. Those are the protocols that determine like how you clean things, as basic as how you clean things, when you change gloves, when you change the gowns that you're wearing, when how you wear and when you wear goggles when you're in patient's room. I mean, one of the most egregious violations that the state found was this now I think infamous incident where, while an inspector was in the room with a nurse's aide, the nurse's aide was in a positive patient's room, somebody who had COVID, and was going to take their oxygen level using a pulse oximeter and take their temperature. And when they got in there, realized, oh, the bedpan was full, picked up the bedpan, walked down the hall to a janitor's closet, emptied it, hopefully cleaned it, but came back, put it back in the room, never changed their gloves, and then proceeded to take the oxygen and the temperature of that positive COVID patient, then walked across the hall to a negative residence room and never changed the gloves, gown, or anything else. And it just, and then people that I talked to, there was one agency staffer I spoke to who quit after one day. She was so appalled at what she saw. She said that she was there during this inspection. It was a 5-day inspection when the state inspectors were there in May.
This was after your story broke, the inspection.
I'm sorry?
This inspection was after your story broke, right? Yeah.
Well, she had called me after she quit, but I was working on the longer story, and we finally reported what she had to say in our longer series, because we hadn't seen, because the way the state works, you don't get the inspection results until 40 days after it's completed. So I believe that was this into the, I want to say this end of the first week in May. So that inspection report wasn't released until mid-June. But everything she said was validated by this inspection report. She described staffers in the building coming down onto floors shouting, the inspectors are coming, the inspectors are coming. And then everybody would put on their gowns like they were supposed to have anyway, and gown up. And then the second the inspectors left the floor, they would rip them off. And she said that there was one staffer who declared that she didn't need to wear any of that because she already had COVID and it wasn't a big deal. But this is repeated in the inspection reports too, just sort of day by day by day.
Egregious
violations of
a complete lack of leadership there. Then a complete lack of leadership.
Well, a lack of day-to-day training. You realize, like, the training. So the director of nursing is in charge of training, and then has RNs or LPNs on each floor who are supposed to oversee what happens on those floors. So yeah, like from so many staffers, like the whole hierarchy within the building, when it was being overwhelmed. And remember, this place already had problems. I mean, the previous 3 years, the inspections just got worse and worse and worse as they, whittled away the full-time staff even more in the time that they owned it. And as many of even the full-timers said, by the time the pandemic hit, I mean, it was just piling bad after bad after bad. It just overwhelmed the facility, because ideally, I mean, one of the things that they should have been doing early on was isolating people. Well, isolating people means you have to take somebody who might not be mobile, pick them up, take all the stuff out of their room, and move them to another room. And then, if they're positive, right, you had to have cleaned the room they were in to make sure it was disinfected. That's hours of work, which when people are quitting in left and right and refusing to come into work because they fear they're going to get sick, you can imagine the kind of management crunch, the numbers crunch that was coming on. They needed more people to help do something as basic as move somebody to a new room. At the same time, they're having to care for an increasing number of sick people. I mean, caring for sick elderly people is labor intensive work. I mean, these facilities have, a place like Brighton has hundreds and hundreds of employees. And then to lose a significant portion of them, they've had hundreds of people there. By June, early June, 3/4 of the building had tested positive. They had 460 people there when the outbreak began. By June, 3/4 of them had tested positive, and at least 82 of them had died. And the figure is probably higher than 82 because Brighton, just like so many other nursing homes, in March, they couldn't get anybody to test the facility. So they didn't even know how many people in the building in March really had COVID. And there were probably people who died in March who probably had COVID and probably contributed to their death.
Unbelievable. I mean, it's all just unbelievable. When I listen to you, talk about this, you see the Attorney General for the state of Pennsylvania, Shapiro, he's starting, you could see he's taking this seriously, right? With a couple of recent indictments. But you wonder how these things are really going to change. How many Brightons do you think are out there in Pennsylvania? I mean,
Too many.
Brighton's one of the, well, arguably the worst case of COVID spread leading to deaths in any nursing facility in the United States from a percentage standpoint. But how many Brightons are out there? What do you think?
As the experts I talked to across the country told me, there are probably Brightons in every state in the country, unfortunately. Now, one of the things that Pennsylvania benefits from and probably suffers from is that, believe it or not, to many people who disagree with how Dr. Levine ran the Department of Health, Pennsylvania has probably reported more data than most states. You know, they were kind of knocked for not getting the facilities to report earlier than they did. It was mid-May when they finally started making facilities report data publicly. But there are some states that never did and refused to make that data available. They would only report it in the aggregate. So we probably have a better picture of how bad it was here in Pennsylvania, I think, than most of the 50 states. So, I mean, even still, and I have huge questions about the data as it exists now, and we could talk about that forever. I spent way too much time over the last 3 weeks trying to figure out just how many people actually died in nursing homes versus personal care homes and assisted living homes, and that by itself has been a nightmare. And it's still not clear to me, and I still don't have good numbers, but I think that's probably true in every state. And this is something we're gonna see research on for years, if not decades. It's going to take, you know, hopefully we're through this in the next year. I mean, really through it, where we're all back to, you know, giving hugs to our friends and family when we see them outside the home and eating in restaurants, but also so that nursing home residents can go back to having activities in their nursing homes or outside their nursing homes and going to concerts like so many of these nursing homes provided, things that made their lives livable instead of being locked in a room. But to get there, after we get there, there's gonna be some significant look backs, really going back and getting the real numbers in all these facilities, finding out what worked and what didn't, because we have a pretty good sense of what worked and what didn't, but there's still a lot of pushback on some of those answers. You know, just one example is, you know, there's been a lot of debate in recent weeks about the state policy that said nursing homes had to accept back positive COVID patients. Dr. Levine was questioned about this at her hearing when she was up for the deputy secretary for the federal government. And there's a state legislative committee that's looking into this. It's not, there is no study that shows either that policy did contribute to nursing home deaths or did not. Probably because it's going to be so difficult to figure out how something like that impacted cases or deaths. It sounds like it might have, right? I mean, forcing nursing homes to take back residents who were positive, right? Inherently, you would think like played some role, right? You know, because having more people in the building with COVID would be a bad thing because more people would get sick. But that policy also included the condition that when somebody tested positive, you had to isolate them anyway, right? They were supposed to be they weren't supposed to be affecting the building. They're supposed to be in a room that only people went in with full gowns and everything, and that they weren't going to spread it around because they were isolated. Well, that was true when they came back too, right? And you didn't have to take any resident who wanted to come into the nursing home who was positive. You just had to take back your residents who came back to the nursing home from the hospital. And in almost every case, you knew they were positive before they left. There are some cases where people were sick, were taken to the hospital and were tested there. But at Brighton, as you know, and other nursing homes, certainly by April, they were able to get tests on their residents. And so they knew who had it and who didn't in Brighton by mid-April. They had tested everybody in the building. So right. Like what role that played at Brighton, what role that played at other nursing homes, I don't think anybody really knows. But if the policy was followed correctly, right? Perfectly, which is impossible. It's impossibly perfect in these circumstances. It shouldn't have affected the nursing homes, especially a place like Brighton, which had, again, had only 460 residents and had, dozens of other bedrooms available in that building because they weren't full. But this infectious disease was so hard to contain in these buildings. Could you seal that room and prevent any of it from getting out, from getting on any of the staff members' gowns, from getting on any of the staff members' goggles, their hands, their gloves?
Right.
That has proven to be really, really difficult.
And do you suspect, and I've seen a couple of nursing facilities nationwide that have closed down because reputation management, they had a lot of COVID deaths. There was a lot of reporting on it. Nobody wanted to send their loved one there. For a case like Brighton, right? For a facility like Brighton that has had so much crap happen, right? And media attention. What does their future look like? Are these people going to still be able to get patients? I wonder if their census has decreased since your reporting.
It actually has increased over time because, as we said in the story, Brighton, even though it's not county run, Brighton for many, many of its residents still remains the home of last resort. Probably a third of the families, and I spoke to probably 50 different families who had residents or had loved ones who lived there as residents, either who had died or who were still there. Probably a third of them told me some variation of the story of, well, we had tried to get into 3 other homes or 4 or 5, and we couldn't.
Why?
Because they didn't want to take a Medicaid patient. Right. Or because of their acuity, right? They had so many comorbidities that for some homes, they aren't set up for the kind of high level of illness that many of the residents of Brighton had, where they not only had dementia, but they had a heart condition, or they had diabetes, or they had a liver condition, all these other factors. There just aren't, and there probably will not be in the foreseeable future, any more homes more willing to take these kind of residents. And you can see it in the numbers. Brighton voluntarily stopped taking residents, I believe, as early as mid-April. They won't give me a definitive date, but sometime this fall, when they kind of self-declared that they were through the outbreak, they started taking residents again, and you could see week by week by week their census going up 2, 3, 4 more people a week, because there are many homes that just are not going to give up beds for many of the kind of residents who lived at Brighton, which is a real sad state of affairs. And nobody out there is building nursing homes for Medicaid residents right now. They're building homes based on a model that has maybe 60 or 70% Medicaid residents, and then the rest private pay.
Well, I think we need elected officials to really step up here, and that this is a complete travesty. And the more I learn about it, the more I think I'm disgusted. It's just your reporting has been so incredible, and I'm sure you're working on more stories related to Brighton. And I remember when I worked for the mayor and there was a unique investigative story. It typically would lead to action from elected officials like Luke Ravenstaw saying, we're going to sue UPMC, which would keep the story going and keep things happening. So I'm hopeful that Josh Shapiro, our Attorney General, and other elected officials in Beaver County, the commissioners, the state representatives, will keep this, let's get to the root of the problem. And it sounds like it's this whole Medicaid, reimbursement situation. It's the agencies, because if you're comprehensive management, they have 13? They run 13 facilities in the state-ish?
I think 15 right now, 15. Right around there.
Okay. So if you run that many, and you're still going to, because look, you have a pot of people that nobody wants, the Medicaid people, you're still you're still going to be in demand. Why change?
Right.
Why improve? Why change? No incentive.
Yeah,
right?
there are discussions on this right now, in part because of that kind of pressure that you mentioned. I know Beaver County commissioners have been really active and pushing for changes at Brighton. The state reps and senators have been concerned about this coming out of Beaver County. The congressional representatives, our U.S. senators. I think this is on everybody's radar now. But whether or not that can lead to action that pushes back against some of the basic tenets of how the system is set up, that allowed this to exist in the first place. I mean, that is a harder question. I mean, because you have so many forces at hand here, right? There are huge advocacy groups on every side of this issue. People who represent seniors, but also really large and powerful organizations that represent the nursing home operators. And then for-profit versus nonprofit. We increasingly have for-profit nursing home operators, not nonprofit. I mean, that has switched over the last 30 years pretty dramatically. And there are a lot of people who think that, they should try to encourage county governments to do it, so it's not a for-profit enterprise. But, we saw what happened in Beaver County. That wasn't that long ago, 2014. They couldn't make it work. They couldn't find a way through it to make it so that it wasn't a drag on their own budget. But I know there are people in Beaver County who have a little seller's remorse, right? They think that if they hadn't sold the county nursing home, maybe this wouldn't have happened, or maybe it wouldn't have happened as badly. But I can find you just as many people who say, look at what happened at all the other nursing homes around the state. I mean, how was Brighton going to be any different, given what happened in so many other places?
Wow. Well, we'd love to have you back on to talk about your next future investigative series. And we're going to be watching this. I act like I'm not a news source, but I personally will be watching what is happening with your reporting into ANA senior facilities, because I've always been most concerned as a citizen with how our government takes care of our most vulnerable populations, and that's kids, youths, and seniors, right? And for a long time, I was on the board of Children, Youth, and Families, CYF. I was just disgusted by so many things I saw and couldn't change anything. I, didn't stay on the board because I wasn't popular. But I see there's so many parallels with, well, we can't really, well, it's just, no, this is not what we're as humans, we have to stick up more for people that can't stick up for themselves. So you're doing that for us.